allergies. I have a stomachache here.
So my general impression of the scene is that I am with a patient who is an older woman and experiencing severe abdominal pain. I'm going to begin by assessing her airway. Since she was able to speak to me clearly and coherently, I know that her airway is patent and unobstructed. It does not appear that she's making any noises, so I know that there's nothing obstructing it. Next, I'm going to assess her breathing. So by the clear indication of the rise and fall of her chest, I know that she is adequately breathing. She does not appear to be turning any colors. She is not pale, so I think her breathing is good. And then next, I will check her circulation. I'm going to look at her wrist and place my fingers on her radial pulse. Her heart rate does appear to be a little fast, indicating possible tachycardia. There does not appear to be any bleeding. And as far as her body, her skin color appears to look normal, and I would not think that any oxygen is not getting where it needs to be. And since the patient is able to speak to me and she seems like she is good, I would label her as alert and conscious. And because there does not appear to be any life-threatening issues or indications, I would consider her a low priority for transport, and I can begin the rest of my assessment. So, ma'am, I would like to ask you a few questions if that is okay with you.
Sure.
So, when did you begin experiencing this pain? What were you doing when it began?
Well, yesterday after I came back from shopping the groceries, I ate, and then after I ate a little bit, I start with the pain.
Okay. Does anything make the pain better or worse?
When I stop eating, it gets better.
So whenever you eat, it makes the pain worse?
Yes.
Okay. And what kind of pain are you experiencing? Is it sharp? Is it shooting? Is it dull?
It's like a sharp pain, like someone is stabbing me on the stomach.
Okay. And where exactly are you feeling the pain? Is it just your upper abdomen? Is it your lower abdomen? Or...
Here, just I with the upper.
Okay. And is it spreading?
No, just here.
Okay, so now I know that her pain is localized to just her upper abdomen. And what would you rate your pain from a scale of 1 to 10, 1 being mild and 10 being like you got hit by a truck?
Well, I would say that it just started like 4 and it's getting worse. Like now I would say it's like 8.
Okay, so now I know that her pain is worsening and her conditioning is getting worse. Now, when did this pain begin?
Yesterday after I ate, I start having some pain, and today after I have like an hour ago when I start eating, again start having that pain.
Okay, and are you experiencing any other symptoms besides just the pain?
No.
You're not?
A little bit nauseated like that, yeah.
Okay. And are you aware of any allergies you have to any medications?
No.
Perfect. And do you take any medications or over-the-counter pills?
Well, for the pain I was taking over the counter and some water medicine.
Okay. And as for your past medical history, since this is your abdomen, have you had any surgeries that have to do with your stomach or even just surgeries at all?
No.
How are your bowel movements?
It's normal.
Have you had any vomiting? I know you said you were experiencing some nausea.
Yeah. No vomiting. Just I feel like a little bit gassy too. No, she's gassy.
And because she is a woman, I'm going to ask her about her past menstrual cycle, because since it is her abdomen, it could be indicative of probable period issues. When was your last menstrual?
Oh no, I am 68. I don't have any period.
So I can rule out that it is not her period. Because it is her abdomen, I'm trying to focus on questions that are centralized to that area, which is why I asked about her BMs, any vomiting, if she's had any past surgeries, those kind of questions. And when was your last oral intake, like when you last ate or drank? I know you said earlier today you're experiencing that again. Was that?
Like an hour ago.
Okay. And what were you eating?
Well, like normal food, like I do once a week, like chicken enchiladas.
Okay, so it's nothing different. It's usual for your body. So now I don't think it would be food poisoning just because it is something that she usually makes. And what were the events that were leading up to the pain that you were experiencing today? So what were you doing today before the pain began? I know you said you were cooking. Was there anything before that?
Well, I just went to do my groceries to buy things for the week. Like
Okay.
that.
And so now that I've asked her any questions pertaining to her illness, I'm going to physically assess the patient. So, ma'am, would you mind laying down for me on your back?
Sure.
So first, I'm going to begin by assessing her abdominal quadrant since the pain is in her abdomen. I'm going to begin by palpating them and have her let me know whenever she's feeling the pain, and also assess how her abdomen is feeling, if it is swelling. So I'm going to press down. I want you to tell me what you're feeling. I'm going to begin by her lower right quadrant. Do you feel any pain there?
No.
Then her lower left.
No.
Now I'm going to go up to her upper left.
Oh, yeah, there.
Okay, and her upper right.
Oh, yeah.
So, as she stated earlier, her pain is centralized to her upper left and right quadrants. As I was palpating, I could feel that her stomach is also swollen and tender. Next, I'm going to look up her shirt to make sure that her abdomen is not bruising, and based off the look, it does not appear that there is any bruising, and that makes me feel comfortable that she does not have any internal bruising. And next, I would use a stethoscope to listen to her stomach and listen for her bowel movements. Okay, now you can sit back up. And I will begin taking your vitals. Now I'm going to take her baseline vitals so I can compare her vitals later on and see if her conditioning is getting better or worse. I'm going to begin by checking her heart rate. So I'm going to take her wrist and take her radial pulse. I'm going to start counting for 30 seconds and then multiply that by 2. Based off of her radial pulse, I would say that her heart rate is about 134 and her breaths per minute are 24. Both are indicative of increased respiration rate and tachycardia. Next, I would use a blood pressure cuff to assess her blood pressure. I don't have one now, but in this scenario, her blood pressure is also decreasing, so it would be 90/60. Then I would check her pulse oximetry, and I would place the pulse oximeter on her finger, and in this case her oxygen saturation is 94, which is below what is normal range. So then for this patient I would administer oxygen using a nasal cannula because it is not too invasive. She is conscious, she just needs a little assistance. She does not appear to be having extreme trouble breathing, and that can get her oxygen saturation in the normal range. Now I've completed my assessment, and I would prepare the patient for transport to go to the hospital for further treatment.